Just debts that's piled up as the hospital goes about its business day to day.
$25 million, that's how much the debt the Guam Memorial Hospital is sitting in. Among those numbers, GMH spokesperson Connor Murphy says $14 million is owed to vendors for medical supplies, $500,000 owed to dietary vendors, $5.9 million for the retirement fund, and $800,000 is owed to doctors who make house calls. Earlier this month, Governor Eddie Calvo approved a $12 million loan to provide some relief to those debts. Murphy says the hospital is now working to determine which bills are critical.
What we're doing right now is prioritizing how we're going to spend the funds that come in and make sure that the loan goes basically as far as it can.
While he says the priority includes ensuring a steady flow of medicines and supplies, Murphy admits that the biggest challenge is that the cash flow is just not coming in to meet the patient's demands.
We collect as much as we can from our patients. We've seen an increase in the number of self-pay patients, and usually those are the hardest to collect from because it's people who don't have insurance, don't have Medicaid, don't have MIP, and they're paying their hospital bills out of their own pockets. So naturally, a lot of them find it hard to pay those bills off. We're mandated to treat every patient that's come through its doors without regard to whether that patient can actually pay his or her bill.
The hospital board is scheduled to meet tomorrow night at 7 p.m. to formally accept the $12 million loan. Murphy says that will serve as the backbone to help GMH recognize what else can be done to pay off the remainder of its past year financial obligations.